Thank you, President Sampaio, and thanks to all of you here for a very warm welcome. I'm honored to be here in Beijing to announce a unique and promising partnership between the government of China and the Bill and Melinda Gates Foundation. I want to thank the Chinese Ministry of Health for bringing us together to accelerate the global fight against TB. I want to thank all the ministers of health and the representatives of more than 24 countries who are here to write national plans to fight TB. I want to acknowledge Margaret Chan and the WHO for their partnership and tireless work against this disease. I also want to express my thanks to Vice Premier Li Keqiang for his leading role in China's rising commitment to public health. I've been fortunate enough to travel to China many times, and each time I come away impressed with the talent, energy, and creativity of the Chinese people. Today, the government of China committed these strengths to the cause of reducing TB, which is phenomenal news. If China leads the fight against TB, developing new approaches here in China and demonstrating them to the world, we will see a dramatic drop in the number of TB deaths in the next decade. We can accomplish something very important if all the world's emerging economies, Brazil, India, South Africa, India, and China, all work together to increase their commitment to public health. This would give us a much higher percentage of the world's people applying their intelligence to these problems and inventing and exporting solutions. That could disrupt the old patterns of inequity and help remake the map of global health. You all know that more than 9 million people develop tuberculosis every year, and nearly 2 million people die from it. And 500,000 patients a year are developing TB that is resistant to drugs that have been effective for 50 years. Some strains have shown resistance to all drugs. Unless we do a better job of treating TB, multi-drug resistant TB will make up an ever-rising share of TB cases until the ratio eventually flips. Instead of having mostly drug-susceptible TB, we'll have mostly drug-resistant TB. Sickness and death would multiply, and because treating MDR-TB costs sometimes as much as 100 times more than treating regular TB, the economics would be catastrophic. So this prospect is alarming, and it should galvanize us to action. And I believe we will prevent this because of the convergence of two forces, urgency and innovation. In the history of the fight against tuberculosis, we've had periods of urgency and we've had periods of innovation, but we have not had urgency and innovation working together. In the 19th century, the urgency of the disease drove people to begin treating TB in sanatoriums. But at the time, there was very little innovation. In the mid-20th century, we had innovation with the discovery of antibiotics. But overconfidence prevented there from being urgency, and research stalled, leading to a period of neglect, literally with neither innovation or urgency. In the early 1990s, the WHO declared TB a global emergency. Urgency returned, and we saw the scale-up of dots around the world, including here in China, which did an impressive job of spreading it nationally. The DOTS approach was an innovation, and it saved many lives. But there was still no innovation in the tools. The most commonly used diagnostic test is today more than 125 years old. The vaccine was developed more than 80 years ago, and the drugs have not changed in 50 years. There's an expression in English that we use when you're caught in a fight, but you can't use all your advantages. We say it's fighting with one arm tied behind your back. For centuries, the world has been fighting this infectious disease with one arm tied behind its back. That's why we haven't been winning. I believe we can have a future very different from the past because we're finally entering an era where we bring together both innovation and urgency. The rise of MDR-TB has restored a sense of urgency, and innovations are finally coming online with the promise of better diagnostics, new drugs, better systems, and eventually a new vaccine. So finally, we are starting to put our talent and energy into this fight.